Welcome back to Beauty Uncovered, sponsored by Olaplex. I'm Danielle Frank, and today we're talking to Dr. Sheilagh Maguiness. Now, she is a pediatric dermatologist who is an associate professor. Oh my goodness, associate professor of dermatology at the University of Minnesota. She's also one of the founders of Strike Club, which is a personal care brand for teenage boys. And she caught our attention on social media for her incredible content that is helping parents all over the world navigate the world of skincare in our little ones. And thank you for coming today.
Thank you so much for having me, Danielle. It's a pleasure.
Well, I have so much to ask you, and I'm by no means a pro when it comes to the skincare for the kids, but I feel like with each child that I've had, we've gone through the gamut of everything.
It's so true. I mean, rashes and skin concerns are like one of the number one reasons that parents seek out, care from their pediatrician in those first few years of life. Up to 20% of children right now have eczema or atopic dermatitis. So super common. So I'm not surprised to hear that your own kids had some dermatologic concerns.
I mean, we were talking earlier. I mean, everything from my middle child had a hemangioma that was huge. We've had eczema issues. We've definitely had the diaper issue. And you feel like such a horrible parent because you're like, I don't understand why this is happening. I'm staying on top of things. I think I'm using the right things. But really, there's so many things that are irritants that are out there for kids.
Oh, tons. Yes. And so, when I think about what my social media, I never thought, Danielle, that I would have a presence on social media. But I'll tell you, I got more interested in it over the past couple of years because parents would always ask me, what should I use? What products are good for my baby's skin? And when I started taking a really deep dive into all the different products, lotions, cleansers, and their ingredients, it really was kind of an eye-opening moment for me. And I thought, I need to just, direct these parents to what's best for their baby, not only if the baby has a tendency for eczema, but just in general, what is great skincare, gentle skincare for babies, newborns, and toddlers?
Well, this is what I want to ask. When it comes to eczema, is that just something that spontaneously happens, or is that usually from some kind of product?
Well, eczema is kind of an umbrella word for many types of dermatitis. And dermatitis just means inflammation in the skin. So when I say eczema, I'm sort of using it interchangeably with the term atopic dermatitis, which is a specific type of eczema that's actually an inherited tendency. Yeah. So over the last 10 years, we've had major advancements in our understanding of the pathogenesis of atopic dermatitis or eczema. And we now know that it's not a problem with your immune system from the inside. It's a structural problem with the skin barrier. Ooh. And it tends to be a skin barrier problem that results in a leaky skin barrier, almost like you're getting too much allergen and bacteria presented to your immune system through the skin.
So how do you test it? I mean, if it's an allergen, do you just do an allergy test to figure out what's causing it?
Most of the time, it's not an allergy, though, Danielle. So most of the time, there is a family history of what we call atopy. So someone in the family might have asthma or environmental allergies or eczema, and those things are all linked. And so what we have found out, about 10 or 15 years ago, we identified a protein in the top layer of your skin, that very top layer, the stratum corneum. There's a protein that is missing or deficient in the vast majority of people who have eczema or atopic dermatitis. And understanding what this protein's function and structure were in your skin really led to so many of the advancements that have since come with respect to eczema, but also all allergic diseases. It's kind of a fascinating topic and something that I've watched over 10 years unravel.
Wow. I mean, and so I would imagine when it comes to the products that are right now out there, that really does lead to a lot of options. Or do we feel like that part of it has not caught up with the science?
It's starting to catch up, I think. I think it's starting to catch up. So, for example, when I counsel moms who come in, how should I best take care of my baby's skin? Well, it's sort of a little bit different when I'm talking about a child with eczema or just a child that has normal skin. But, in the first 2 years of life, the skin barrier is not quite mature. It's thinner. It's more permeable in general. And those babies have a larger body surface area. So they tend to absorb more through their skin, and it has more of an impact on them. So in the first few years of life, you really want to keep things very simple. And I think we're starting to get there. I'm starting to see a lot more lines that are fragrance-free, hypoallergenic, where additional testing has been done to ensure that those ingredients will not cause an irritant or a contact reaction. So I'm starting to see that more.
And yet it's so funny when it comes to baby products, the fragrance-free, it's not like as common as you would think. It's fascinating how many products have fragrance in it.
Oh, almost all. It's actually really hard to find a good fragrance-free baby lotion, to be honest. And so part of my parent education for skincare is moving away from those fragrance products, because you probably know this, Danielle, but fragrance in the US is not regulated. Yeah. So there can be a lot of different chemicals, even up to 100 chemicals in one fragrance. And the proprietors are not made to disclose what those chemicals are, because it's sort of their own blend. It's like a secret. So even if a fragrance is natural, it could still be irritating. Or if it's a synthetic fragrance, it could be made up of a lot of chemicals and still be irritating. So my message to parents is, remember that your baby doesn't really care about the smell. Like, they're not supposed to smell like lavender. I mean, it's really for the parent and the parent
we love
experience.
That baby powder smell.
Yes, I know. But unfortunately, it can lead to, I think, more irritation and just, exposure to more chemicals for babies in general, I think.
And it is fascinating because I think of, even right down to baby shampoos and stuff, it really is very prevalent. I know, like I said, when it comes to the skin irritations, eczemas and everything, it really can come from a lot of different sources. Of course, there's hereditary. My kids have that from their father's side. But also, word of caution, my son, when he was at a certain age where he didn't want me to necessarily wash his hair, wanted his independence, he would not necessarily rinse all that out.
Oh, yep.
And over time I'm like, what is going on? Couldn't figure it out. Until I finally got him to a dermatologist that looked at me, looking at him, put a little water on his head and made some suds.
Oh my gosh. Yeah, that can build up for sure.
And really, seriously, it made a really horrible skin problem. But I think that it really is important for everybody to have an understanding of how these different products really impact you. So what are your go-to for parents that are just like baseline, everybody should have it in their arsenal?
So it'll vary a little bit by age, but for newborns and babies, a gentle, hypoallergenic, fragrance-free cleanser is a really great start. And so what has been happening is that companies are kind of getting savvy to the fact that there were harsh surfactants used in the past, like sodium lauryl sulfate and cocamidopropyl betaine. And they're now replacing those with milder, gentler surfactants that don't foam as aggressively and don't strip that skin barrier. So I would say that gentle surfactant in a hypoallergenic cleanser, there's a couple of really good options on the market. And so those would be where I'd be kind of steering my parents to for a cleanser.
It's interesting because I think that as a parent, you can't help but it's almost, I think, instinctual. Like you're washing a baby or anything, your hair, whatever. And you want that sud, you want that foam, thinking I'm getting them clean, but it's not necessarily the case in this.
No. And I think you're going to see that too, as you move up, into gentle cleansers for the body and also, for faces, for teens, that suds, the really foamy cleansers that strip and dry can really cause some irritation, especially when someone's going to layer on different products, for example, say to treat acne. So you really don't want something that's excessively foamy. That's going to strip and be, overly drying. Unless you have really oily complexion and you need that, I'd say to steer clear and have things be very gentle and pH balanced for the skin. Slightly acidic is where you want to be there, especially for face.
So I'm going to ask, because I was thinking about it with my son's scalp, Cradle Cap. I'm assuming is that an eczema?
Cradle cap is so common, Danielle, and it can be one of the first signs that that child is going to have dry, sensitive skin and a tendency for eczema. And what you might remember is that when you are told as a new parent, go home, take the baby. No one tells you, how often should I bathe the baby? What kind of bath should I use for my baby? And unfortunately, there are no great prospective randomized trials about how to best care for the skin of a newborn. So all we have are really kind of guidelines and best practices. So what I usually tell new parents is, don't forget that when you soak your baby in that baby tub, like, you're not getting their head and neck wet. So you really want to pay attention to that. Remember, like, the baby's head is sticking right out of the tub. Like, are you really cleansing that scalp, getting rid of the dead skin and yeast and bacteria that are there? So I always say, don't neglect the scalp. Put your baby in, put a washcloth on the scalp, make sure you're saturating it, use a little gentle cleanser on there, because you do ultimately want to, cleanse gently that, dead skin away. Because if you don't, it will build up, and then Pityrosporum and other, species will get on there. And then all of a sudden you're having an inflammatory reaction, which is really, the cradle cap or seborrheic dermatitis. And if it's left to continue, then you can have itching and discomfort, or maybe even a secondary infection. So I'm a firm believer in that bathing and moisturizing from an early age in infancy is a really great way to take care of your baby's skin.
Do you feel like the seborrheic kind of dermatitis or cradle cap or anything like that is kind of the same as with an adult? I mean, would you go by the same kind of concepts, or is it like totally different?
No, I think it's a little bit the same, because as you get towards, there's still maternal hormones and things at play, a little bit of oil production on the baby's scalp that can lead to those other, yeast and other things on the skin. Certainly in my teen patients who I see some seborrheic dermatitis in, they may not be washing their hair as frequently as we feel that could be beneficial for them. And sometimes
or
we'll
as
add
thoroughly.
or as thoroughly, because that's when they start to take control of their own personal care, and we want to empower them to do so. And you don't want to be looking over them all the time, but
you don't want to be a weird keeper.
Right. But if you don't say, hey, like, are you washing your hair at least every other day, putting a conditioner in, making sure you're not over drying the scalp or not letting, the dead skin and stuff build up on the scalp, which can then cause seborrheic dermatitis.
Very, very good points. It's a tough one navigating, and especially when they're getting to that age where they're getting so independent and you're like, I know you're not doing this right.
So true. So my two boys now are 8 and 10. So I am just right there, kind of on the cusp of all of those changes and empowering them to try to take control of their self-care as well. So we're getting there. Not quite there yet, but soon.
So I being that we're in the summer, we're in the heat of it. And so we have a lot of people, new parents and just parents in general that have kids, regardless of your skin type, regardless of color. What are the safe things that they should be doing to protect themselves from the sun? Because obviously the sun can cause a lot of damage.
Absolutely. And I always like to start these type of conversations with parents by saying sun protection is so much more than sunscreen, right? Especially with kids, under the age of 5. It is so much easier to use sun protective clothing, shade, and hats than to get enough sunscreen on them that's going to do the job and be reapplied every 2 hours, in a busy, fun environment where you want to be thinking about other things. So sun protection is more than sunscreen. It's just one part of it. So I talk about the UV index. If you scroll through your weather app on the phone, you can find the UV index there. If it's 3 or more, you need sun protection. You need full protection. And what does that mean? It means that these kids should be wearing a hat to protect their face. They should be wearing protective clothing if they can, especially if they're an outdoor family that, are camping or on a boat or where they're really going to be outdoors for long periods of times. Those are so much easier to do than to get on enough of the sunscreen, because we all know how fun it is to put a lot of that pasty sunscreen on a wiggly toddler. Now we do it and we have some tricks to make it better, but It's this protective clothing, I think, has come a long way in the last like 5 to 10 years. There are great UV fabrics, protective, lightweight, that wick away the moisture, and they're really great. I like them for swimming and for, just rash guards in general.
So it's funny because my kids during the summers were always very much about swimming and all that. And I would obviously cover them up and everything. And my 2 older sons, they never had a problem. My youngest son, I swear to God, he has got to be the whitest white boy in the whole entire planet. And it's a challenge. Like I felt like I was applying product all the time. I mean, we had protective clothing, but it was like that one area of skin that you didn't get. And it was horrible and it was painful. Yeah, so we actually arrange, like if we're going to go swim or go to the beach, we actually arrange our timing very, very carefully so that it's like later in the day, earlier in the day, never in the middle of the day. But when
you're such a good mom. That's exactly right. That's sort of matching the UV index. And when it's highest, you want to kind of stay in the shade. And when it's lower, you can go out.
Well, I had one, and all it takes is one time where you're putting on product like mad. And he winds up getting so burnt that he had a fever. It was terrible.
Oh, I'm sorry to hear that. Yeah.
I mean, he was all of like 5 or 6 years old, but I mean, I will never forget that feeling, just like, I thought I did the right thing. But it does make me wonder about when it comes to skin care, when it comes to sunscreen, like what is the standard? Because, nowadays you have, the 20, the 30, the 50, the 1,000.
It's true.
And also method of application, because there's the creams, there are the ones that are spray on. But then also now they have the ones that are, which I admittedly like using on the regular, the ones that are very much, they're not the greasy kind. For
like a balm, like the stick.
Yeah, it's. I actually use it under my makeup sometimes, but it doesn't have any kind of sheen to it whatsoever. But is there a preference? Or is zinc oxide? Like, what is the best thing to do?
So getting into the sunscreen conversation, I'm going to just flat out say that any sunscreen, any one that you choose that you wear regularly is better than nothing. Okay. So like that's the baseline. You need to wear sunscreen. SPF 30 or greater is typically what's recommended. You do need to reapply it every 2 hours, or maybe even more than that if you're swimming or sweating. But my attitude about sunscreens changed a little bit in 2019, and I'll tell you why. So I've started the conversation saying any sunscreen that you would wear is better than nothing, but I've changed my preference for sunscreen. And let me tell you a little bit about why. So in 2019, there were a couple of studies that came out in some of our major medical journals that looked at some of the chemical sunscreens. So when we look at different sunscreen molecules, they're divided up into chemical. Those are also called organic sunscreens, or mineral, which are inorganic sunscreens. And so the mineral is easy. There's just 2. It's zinc oxide and titanium dioxide. But there are a whole bunch of these chemical sunscreens. And we've been using them for years. I'd use them. I use them on my kids. They do a good job because you combine a few of the molecules, you get great UVA and UVB protection and a high SPF. So they're very effective. And what they do is they sort of sink into that stratum corneum, and they absorb the UV and kind of change it into energy so that it does not damage the DNA of your underlying skin cells.
Okay.
But what happened in 2019 is that one study, and then this was followed up by another, documented that after one application of several of these sunscreens, they were rapidly and readily absorbed into the bloodstream and found in, blood, urine, basically body fluids. One application only. And, when that happened, the American Academy of Dermatology said, okay, well, we still think this is safe. People have been using them forever. And I do agree. I think we just maybe need more data about it. And what happened after that was that the FDA sort of changed their recommendations on what is generally accepted as safe. So the GRACE, the generally respected as safe and effective. And they changed it to basically only zinc and titanium while they await more data for what it means about these chemical sunscreens. And I think that for teens, when an aerosol spray is all they'll use, it's better than nothing.
Okay.
But toddlers and babies, as I just kind of started our podcast talking about, have larger body surface area to weight ratios, thinner skin. I think they're probably going to absorb more of the sunscreen than maybe you or I would.
Wow.
So my preference there, I would say in 5 and below is definitely a mineral-based sunscreen. And yes, those are the white pasty ones that sometimes leave a white cast, although I do think they are getting better with their formulations.
Yeah, I was going to say that's so fascinating, though, that it would go into the bloodstream.
They're small molecules and they can penetrate.
Wow. Well, I mean, we're going on a boat this weekend, so I think I better get some zinc oxide because that makes more sense to me. And quite frankly, at least with my boys, they never mind it. So they look, they have the ones that are now like all kinds of colors.
They do. They have clear zinc, they have nano zinc. And then, of course, you get the controversy about environmental impact and reef safety. And that's a whole whole issue as well, because it needs more study. We still don't know the impact totally. We need more data. Certain sunscreens in different areas of the country are banned, or in Hawaii, for example, some states have banned some of the chemical sunscreens. So that's another whole issue that we need more data. We need to know a little bit more about the impact of the chemical sunscreens over time.
So what about sunburns? I mean, it's inevitable. It's inevitable. It's like I said, I will cover my son completely and there'll be that one spot. But I'm like,
I know. Here's the thing. Nobody's perfect. Mistakes happen. We forget to reapply. If you have a sunburn, keeping yourself or your child comfortable is the number one thing. So cool compresses. Aloe vera is something that is often touted as being cooling and helpful. And I think that's true. But I also really think that a mild topical steroid ointment helps a lot with sunburn. So even like an over-the-counter hydrocortisone can certainly be helpful for the inflammation caused by a sunburn.
So, I mean, do you feel, are you aligned to the idea of that you should be moisturizing a lot so that
yes.
it doesn't dry out?
Absolutely. Yes, you need to moisturize. And please don't pick or peel your sunburn off, because you certainly, don't want to do that. You can cause more trauma to the skin, introduce sites where it could potentially get infected. So yes, Vaseline or Aquaphor, like a petroleum jelly-based ointment, is great because also they don't have any alcohols or preservatives, so they're not going to burn or sting the skin when you apply them.
Is that also like Aquaphor? Because I love
Aquaphor and Vaseline, very similar. Yep.
The day I discovered Aquaphor, I was like, this is the best thing ever.
Yes,
it really is amazing.
Yes. Someone on my TikTok actually posted a comment that said, I think Aquaphor could solve world peace.
Right?
Which I thought was really funny. But yes,
I have to admit it. I've used it on a lot of occasions for a lot of different things. Even like when I used to live up north and it was particularly cold, before we would put on gloves, I would have put Aquaphor on my hands. Like it was like I love that stuff.
Right. It's such a good, both of those, Vaseline and Aquaphor, both contain white petrolatum. So it's a petroleum jelly product, but it's a very large hydrophobic molecule. So what happens is that when it's really my favorite thing for like hand dermatitis, lips, eyes. It really, if you put it on, especially when the skin's a little damp, you'll lock that moisture in and prevent it from evaporating from the surface. And then your stratum corneum can kind of regulate underneath it. So it's really one of my go-to favorites. My favorite for eczema definitely is the petroleum jelly-based moisturizers.
That is amazing. I do want to jump into Strike Club because obviously, well, I have a 12-year-old, he's preteen, and he is starting to, like, the first time he's like, what is that? And had,
it's a pimple. Oh no.
It's a pimple.
What do we do?
It's funny because like in my family, and certainly myself, I've always was very lucky. As a teenager, I get that one or two random ones and that was it. And so I'm hoping that, they have the same, but I've also had family that had really, really bad acne. Mm-hmm. And yeah, it's very confusing with all the products that are out there right now. They've been around forever. And now we're hearing that they're not necessarily the best things for us. So I would love to hear a little bit about Strike Club and what really differentiates that.
So we founded Strike Club in 2020. It's myself and 3 other moms, and together we have 11 children between us. And
oh my!
What we were noticing is that we would go and try to find a solution for pimples and acne over the counter, and we could find a lot of things that were kind of marketed towards girls. They were pink, they were fruity, there was a lot of that kind of feminine marketing. And when we went to search for something for our boys, we kind of came up short. It was either we borrowed from the girls, or it was those medicinal products that you just described from the 80s
right.
that have not changed, or, so we really saw an area where it was really time to do something innovative, and especially for boys who had kind of been left out of skincare and personal care. And I felt that resonate with me as I have these 2 boys that are just on the cusp of puberty. And so it really made sense for us to come in and create a really streamlined, effective approach to, early skincare for teens that really focused on empowering them to take control and to, kind of get into self-care for themselves and kind of remove the stigma that had been there about self-care surrounding boys. And so we're really hoping that message comes through with Strike Club.
Now, for full clarity, because I did look at the product line, I looked at the website, and it is really great. I love it. But that's the thing. I really loved it. I sat there thinking, oh, teenage Danielle would have loved this. So is it only appropriate for boys? I'm like, is it formulated only for boys, or is this something that also girls could use if they were interested?
Listen, Danielle, anyone can use Strike Club. I use it every day.
Okay.
Our whole team is really obsessed with it because we formulated it, for teens that tend to get acne. And so I really did that with a very intentional set of formulas for the cleanser, the moisturizer, the wipes. I really wanted to use a very gentle surfactant so I wasn't contributing to irritation, because a lot of teens are needing to use things for acne on top of their cleansers. And, over the course of years in my practice, treating eczema and skin infections, I've had a lot of luck with sodium hypochlorite. And that is the sort of like hero ingredient of our brand. And so you can kind of think of it like a benzoyl peroxide. It's because it's antimicrobial. So it helps to gently wash bacteria away. But it's different. It works differently. It doesn't bleach fabrics. And I feel like it's a very gentle approach for those teens to start with.
So, I mean, all of us, when we were growing up, we had our routines, though personally in my life, it was Ivory soap. But
right?
Yeah. That's all we had. I had 10 brothers and sisters. We had a bar soap.
Oh, yes, exactly.
But I mean, as we have these, young men, young women that are growing up, and let's say they have products, to maintain their skins, what should us as parents be directing our children to do? Should it be like washing their face at the end of the day? Is it twice a day? Is it moisturize? Is there a particular recommended routine that they should follow?
Yes, I think there is. So when I see teens in clinic, a lot of times, just as you kind of hinted at right now, they are not even washing their face. They don't know how, they don't know what to use. They're using whatever's in there. Some kids are washing their face with shampoo, for crying out loud. I mean, whatever's there, they'll use. And I found that to be especially true for my male patients. And I don't know if that just, is part of the stigma, or maybe just less knowledge about skincare, less targeted marketing about skincare. I don't know. But yes, I think it all starts with washing your face. If you can get your teen and preteen to wash their face twice a day, that will go a long way. It really will. It will remove dead skin and bacteria. It will help, with other products that they might be using to moisturize after that. And certainly if acne is a little bit of a problem, you can then add in an easy spot treatment. Or if acne is more of a problem, you can add a topical retinoid. And when we built our brand for Strike Club, we really needed all those components there. So all of that is incorporated in our line with, in the intent to make it easy and quick and fit into a busy teen lifestyle, but anyone can use it.
So when a teen is starting to have a breakout, right? Would you say it's more likely routine, diet, hormones, or is it just kind of like a gamut of all of it? Because I mean, you don't have like, I'm sorry, but I used to have my mom be like, well, you shouldn't have been eating X, Y, and Z. I try not to do that to my kids, but I mean, if there is something that's preventative, I want to make sure that they understand there is a cause and effect.
Mm-hmm. And you kind of hit the nail on the head there, because acne doesn't have one cause. It's actually multifactorial. Part of it is genetics. How did you inherit your pattern of the way that your skin turns over? That's partly genetics. Partly is, do you have an oily complexion that tends to get, those clogged pores? How does your host immune system respond to the bacteria and the things that are on your skin, like the Cutibacterium acnes? And then there's hormones. So as we get into puberty, we have more of those androgen hormones surging. The androgens, or the testosterone hormones, really do have a driving force with acne as well. So those really are the main factors. The diet, the environment, that's sort of less important, but it's a question that comes up all the time. So with respect to diet and acne, there are a couple of things that have been shown, with, pretty significant associations, not really significant, but there's some evidence to support it, that probably skim milk, excessive quantities of dairy, skim milk is probably linked. We don't really know why, but that is one that has been studied and documented. Certain supplements.
Makes a lot of sense.
Mm-hmm.
Because dairy in general is known for inflammation and everything like that. But it's very funny though, because I don't get breakouts at all. But I recently had one and I was like, what on earth? I was hormonal, which made me eat ice cream. So it probably was a combination of two.
You could blame that. Yeah, blame them both. Actually, yes, probably a combination of factors. But yeah, it seems like certain supplements like whey proteins or certain B vitamins, even of all things, can sometimes lead to a flare. Yeah, but not many foods, So the idea that acne is caused by poor hygiene or like things that you're doing wrong in your diet, that's sort of been dismissed now. We know that it's like a combination of all those other factors that we just talked about.
And I actually want to see if you can bust a myth.
I would love to bust a myth.
Okay. So I was told from a very young age that acne, where it shows up on your face, has to do with different causes or something that's going on internally. Does that make sense? Like, in other words, if you got acne by your nose, or if you got it by the corner of your mouth, or if you got it on your cheeks, that they all had different causes.
Oh, that's interesting. I think it could be partially true. Okay. So when I'm treating a patient with acne, if they have, especially if it's a female, and they have a lot of pimples and pustules in the mandible area, so kind of that area where, you would have excess facial hair, or males would have facial hair, that does sometimes correspond with excessive hormones or male hormones. So PCOS, polycystic ovarian syndrome, sometimes patients will come in and they will have acne in that area. And we do think of that area as one that's more predisposed to hormonal acne, hormonal impact on the acne. So that's partly right.
Okay.
Mm-hmm. And I do think that the forehead is more prone to comedonal acne. So when we talk about acne, we divide it up into comedones, which are whiteheads and blackheads, and then inflammatory acne, which are those pimples and red inflamed pustules. And in some cases, there can be a lot of those whiteheads and blackheads on the forehead. And sometimes that's due to occlusion from wearing your hair a certain way, or something is causing a little bit of occlusion there. And you can get quite a few blackheads under there.
And is blackheads and whiteheads, is that prevented? Can you prevent that? Or is that something that just kind of like the dermatitis, it could be hereditary?
It could be hereditary, but yes, you can prevent it. And so when we treat acne, one of the things that we first do is get that cleansing regimen going, a gentle cleanser. And then if there are blackheads and whiteheads that are predominant, especially in that T-zone, the forehead, nose, chin, we would add a topical retinoid. And the strongest topical retinoid that you can get over the counter without a prescription is called adapalene.
Adapalene.
Mm-hmm.
Wow. Okay. Admittedly, I never had them.
Well, you have beautiful skin, Danielle.
I was lucky.
I'm looking at your
lucky.
skin
I keep
right
on saying
I,
by the time I get to a certain age, I'm going to have some issues. But
Maybe not. I don't think so. You're doing a good job with sun protection. That's great.
Trying to. I didn't when I was younger. That's for sure. I probably was constantly running around with no sunblock, but
well, we know more now than we did then, right?
Yes, we do. Yes, we do. This was so wonderful. Could you again tell our listeners where they can find the products that you were speaking about with Strike Club? Is that on the website?
Yep. So we have a direct-to-consumer website at strikeclub.com, and it's strike with a Y, STRYKE, Strike Club. And we excitingly just expanded so we've been in Target online and in certain stores, and we expanded to Walmart, Amazon, and Urban Outfitters this year. So we're pretty excited about that. Yeah, it's great.
Oh, wow. So wherever you happen to shop that makes you happy. Because I might have an Amazon addiction.
I think most of us do. It's super convenient. And so it's definitely, I think, here to stay. Yeah.
Like my dog gets a little too excited by that truck pulling up now. So, yeah. Anyways, it was such a pleasure talking to you. I feel like I've learned so much, and thank you so much for all the information.
Me. Thank you so much. I've really enjoyed listening to a few of the podcasts, and I'm going to tune in to all the new ones. So thanks a lot, Danielle.
I'm so glad. I'm so glad.